Dr. Deepa Rajendran, Senior Obstetrician and Gynecologist at Fortis Richmond Road. Today I'll be talking about women health and women health screening, especially above the age of 40 years. It's very important to take care of us as we women tend to juggle between family life as well as professional life. And in all of this hustle and bustle, we forget to get ourselves checked. And therefore, it's very important to prioritize and make a conscious effort to go to your doctor, your gynecologist or your physician and get yourself an annual health checkup and routine check as per the doctor's advice. Now, women health is different from the routine health checkup, mainly because the screening also involves screening of the female organs. Now, when we talk about the screening test, the importance of screening test is basically to identify any precancerous lesions. If there is any family history of certain diseases, to identify it at an earlier stage. Other lifestyle-induced diseases like hypertension, cholesterol, high cholesterol, high sugars, all of which can be identified at an earlier stage and managed relatively more simple than picking it up at a more complicated stage. If I have to go point-wise with women health, I would like to start off by saying that a routine investigation, when you go to the doctor, routine blood investigations involving to check regarding your regarding your blood pressure, your diabetes status, your cholesterol, and other basic blood panel investigations, which help to tell you if there is anything wrong systemically. Secondly, you have specific organ screening screening tests. First, starting off with your breast examination. But when you go to your gynecologist, your gynecologist will recommend for a breast examination, wherein your breast will be examined, after which, especially above the age of 40, it is recommended to have a mammogram. If you have a family history of breast cancer, the gynecologist may ask for a more frequent mammogram, maybe once in 2 years, or otherwise you could have a mammogram once in 2 to 5 years. In mammogram, basically any other lesion, underlying lesion, or any suspicious sites can be identified and can be later investigated and evaluated with further definitive tests. The next form of screening for females is the cervical cancer screening. The cervical cancer screening is done firstly by doing an internal organ examination visually, followed by a pap smear test, which is one of the most simplest and most cost-effective screening test for cancer cervix, wherein the cells from this cervix are taken during the test and then analyzed under a microscope by a pathologist to identify any precancerous lesions or cancerous lesions, and accordingly your doctor will manage from there. The next other important female screening investigations or tests would be testing any colorectal pathology. Now, colorectal pathology is basically any intestinal pathology. Now, a routine colonoscope is advised for females at least once in 1 to 2 years. If you are again belonging to a high-risk category, that is a family history, immediate family history of anything or any malignancies related to the colon, then you may be asked for a more frequent screening. However, routinely, at least once, it is important once in 1 to 2 years to have a colonoscopy done. The other most important screening for women is your bone density analysis. As we age, especially in the perimenopausal and menopausal age group, we all know that the bone density starts to come down, basically because of the hormone changes. It's important to know this and hence also get evaluated, and based on which you may be started on certain medications, supplements, which will help counter this deficiency. As a result of which you can prevent a lot of grave outcomes which could occur as a result of low bone calcium density. The other screening tests testing for your eyes to make sure everything is fine, so you'll need an ophthalmologic checkup. Dental checkup. Dental checkup is very important to make sure that there is no infection, there's no cavities. If required, accordingly, whatever management your dental doctor will be advising you, it's advisable to follow it as age advances. A very important aspect of female health is mental health, which is often neglected because it's not spoken of much. And like I said in the start, especially because women juggle between home, family, personal life, there's a lot of stress, and the kind of lifestyle we all lead, there's a lot of stress factor involved, and which affects women, especially in the advancing age group, with a lot of hormonal changes. And especially since they do not talk about it, it's very important to include this also as a part of a screening to identify any sort of mental health issues. The most commonest being depression. It's important to address that as early as possible, and if required, necessary treatment can be started. Having said this, it is advisable every woman at least goes for a health check, a full body examination with investigation, as well as a clinical examination by your physician or your gynecologist routinely, at least once a year, and let your doctor decide what further investigations or what further in-depth analysis is required based on your history, your family history, and also your medical history. As we all know, a healthy woman is the key to a healthy family, and a healthy family is the base to a healthy society. Thank you.